some severe cases. So my message to you here now is that easy to buy does not mean risk free. Always use medicines as directed, and ask your pharmacist if you are unsure on how to take a certain medication. Thank you.
That's 100% correct. As Ombudsman has stated, always ask questions. As a patient, you are entitled to ask questions because all these medications are going into your body, so you deserve to know what exactly is going into your body. The next statement is natural doesn't automatically mean safe.
Natural does not mean automatically safe. Facts. Facts. Natural does not always mean safe. Herbal medicines, they are natural. Dietary supplements can cause side effects. In as well, herbal medicine also natural. They can cause what we know as allergic reaction. They can also cause what we know as or interact with prescription medicine. Example, somebody who is taking a blood thinner. Example of blood thinner is warfarin. Yes, warfarin. Then the person is taking it together with a dietary supplement known as what we know as ginkgo biloba. You combine warfarin and the ginkgo biloba together. So ginkgo biloba is not a drug, please. It's not a drug, but a dietary supplement. You combine with a medication with a drug, which is warfarin. Warfarin is a blood thinner. If you combine this together, these two combo, then you have increased the chance of what we know as severe bleeding. So severe bleeding. Always tell your doctor or pharmacist if you are taking any herbal medicines or herbal product or supplement or natural remedies you are taking. Just let them know, understand your medication history. So their medicine, okay? So you let them know, okay, this is particular product or drugs I'm taking. Have the list and let them understand the drugs you are currently taking before another one will be prescribed to you. Because by not doing so, then by the time they prescribe those other drugs, combination with the one you are taking, so this can lead to serious side effects that you may not really know or you may not be able to control when emergency arises. So always tell your doctor or pharmacist if you are currently taking any medication. Thank you.
That's absolutely correct, as Ombudsman has rightfully pointed out. So the last statement is if two medications are good or two tablets are good, then four tablets are better.
4 tablets are better. Big myth. Taking more medicine than the recommended dose, I've said it earlier on, does not make it work faster or faster or better. Instead, it increases the risk of what we know as a serious side effects. So ibuprofen. Let me cite an example. Ibuprofen, it's a painkiller and it's a class of drug known as non-steroidal anti-inflammatory drugs. These drugs stop the pain or inflammation. So, and they work, the ibuprofen or diclofenac or any non-steroidal anti-inflammatory, they work by stopping what we know as a COX enzyme, cyclooxygenase enzyme, either COX-1 or COX-2. So COX-1 enzyme is a very good enzyme in our system because it's this enzyme responsible or protect our stomach lining, and also they also support the platelet functions, support the kidney functions also. Why COX-2 is the bad boy, is the bad enzyme. So COX-2 enzyme is the one responsible for the production of pain, production of inflammation, and the production of fever. So if you take diclofenac, if you take ibuprofen, naturally, automatically, you have stopped the action of COX-1 and you have stopped the action of COX-2 because ibuprofen or diclofenac will stop the action of these two enzymes. Now you have stopped the action of enzyme that is even responsible, that is even good to your own health, which is COX-1. So you stop the COX-2. We know COX-2 is not good. So that is why when you are taking this ibuprofen, you are exposing yourself and you are increasing the chance of you having the stomach ulcer because you are stopping the enzyme responsible for the stomach lining. So now talk of when you are now increasing the dose of that ibuprofen. So more medicine does not mean better treatment. So always take the right dose at the right time and exactly as directed by your pharmacist or by your doctor. Thank you.
That is absolutely correct. Sam Lookman has told us the absolute truth because you took two medication and maybe you don't feel better does not mean you should take more medication. You have to wait for a
Exactly.
proper prescription before you move on to doing that. Okay. And like I said, I hope we are all getting down and paying attention because right now we are going to be moving into finding out what is the solution to all these mistakes or problems. Is it that there is something that cannot be solved or there's no solution to it? So from Lukman, what practical steps can people take to stay safe and maintain effective drug use?
Thank you, Dr. Chidima. The good news is that medication safety does not have to be complicated. I usually encourage people to remember 6 simple rules. 6 simple rules that can greatly reduce what we know as medication related problems. You know, be able to remember these 6 rules, then you have saved yourself from what we know as medication or prevent yourself from medication related problems. Rules. Rule number one, know what you are taking. Know what you are taking before taking any medicines. Always ask this following question: the name of the medication. In fact, as a patient, you have the right to accept and to reject treatment from any healthcare provider. Ask anywhere that a pharmacist lied to you. You have that right to accept and to reject any treatment. So that is why it is important for you. Ask that healthcare provider, maybe a nurse who is about to administer those medications. Nurse, what is the name of the medication you are about to administer? So, and then why are you taking it? Why are you administering these drugs to me? What is the purpose? Then ask those questions and also ask the patient, or I mean, sorry, the nurse, the correct dose and when to take it. Is it the drug you have to take in the morning or in the evening, bedtime, 12 hourly, 6 hourly, 8 hourly, once daily, ask those questions. And also, lastly, from rule number one, also know what we know as a possible side effect. I've experienced this in practice also. They gave one medication to one patient. So that man experienced what we know as a serious reaction. So then I asked the nurse, I said, oh, I hope this person you have explained the possible side effect. So unfortunately, nurse said she explained to the man, but the man was not paying a keen attention when the nurse was explaining that to the man. So the man was receiving phone, was answering a call. So after some days, the man returned and said, "Oh, I'm experiencing this, I'm experiencing that." The nurse not even went ahead and said, I chatted you that, oh, these are the possible side effects. But the man, people too, they don't even take their head serious. But the man, they call business, drop the cargo somewhere, health is more important than all this cargo. It is only who is alive that can count the number of cargo that comes in. So never take a medicine they don't understand. So rule number two, you are learned, educated. Nobody is stopping you not to do some certain thing for yourself. So now rule number two, read the label carefully. Read the label, the drug label carefully. Always read the instructions. Even if you have taken the medicine before, pay attention on how much to take, uh, how often, the frequency, whether to take it with food or without food. There are some medications, when you take them with the food, you will not achieve any effect. Believe me, you will not achieve any effect. Before you start hiring police and the civil defense or whatever to arrest your healthcare provider, listen very well. If you don't follow instructions, you will not achieve the effect. So a few minutes spent reading the label can prevent serious mistakes. Please and please. So that's rule number two. Rule number three, I will say store medicines properly. So medicines are sensitive to the environment. Avoid exposing them to one, excessive heat, you know, direct sunlight and moisture. And remember, when you want to store your medicine properly, always ensure you keep your medicine out of the reach of your children, because once they take this, they can easily take it and they took the medication. Maybe this medication is not really for children, then you have caused more harm to yourself. So rule number 4, always check the expiring dates. Never use expired medication. I believe no healthcare provider will dispense any expired, or no pharmacist will dispense any expired products or expired medication to you. So over time, medicine can lose their effectiveness if expired, and in some cases expired products may become so unsafe. And then I want to encourage you to make it a habit to always check the expiring dates before taking any medication, please. Rule number 5, keep an updated medication list. If you know you cannot remember those names, the names can be so somehow. Say, okay, diazepam, tranexamic acid, meloxicam, celecoxib, phenoxybenzamine, barbiturate. Those names are sounding so heavy. I know can be so difficult, especially when you are not you are a non-healthcare provider or not a non-medical student. This can be somehow, but nobody is preventing you or stopping you not to have your own list. You can have your list. Okay, this so day, this is the current medication I'm taking, your maintenance drug. So because when you are visiting the hospital, your healthcare provider, if they ask you the medication history, you can easily bring the list out and say, okay, this is the list of the drugs I'm currently taking. But you cannot remember the names, you can't remember, you don't have your list, then you are not helping yourself. It might be difficult for them to take good care of you. So that is rule number 5. So rule number 6 here, I will say ask questions. That is the last rule that I've mentioned here. Ask questions and consult healthcare provider. I don't know why people these days they always have phobia of talking to healthcare provider. Especially people say, talking to those nurse. That nurse, once I look at the nurse height, the eyes is to so no, everybody knows the ethic and they are professional. Ask them questions. They are there to assist and to help you. So if you are unsure about why you are taking a medicine, please ask question. How to take it, if you are unsure on how to take it, my dearest, my listeners, please ask question. If you are not sure of unsure of your possible side effects, also ask question. You are not sure of the possible drug interactions, ask questions. What to do if you miss a dose, ask question. When you miss a dose, please, a drug meant to be taken 12 hourly in the morning and in the night, or at the night, then you forgot to take the morning one, but you remember at night, please don't combine that together and say, oh, because I have already forgot the one morning, let me use the opportunity to take together. No, let it slide, skip it, just continue the evening one or the night one from the moment you remember. Continue and forget about it. Don't combine any missed or skip medication. Don't combine them together. So please and please remember, pharmacist is one of the most accessible healthcare professional. So if in your community you forgot anything, you can walk to, I'm not saying you should go to drug vendor. We have people parading themselves to be, I'm not saying you should go to drug vendor. Go to outlet where they have a licensed and a certified pharmacist. So access, they are always there to entertain your concerns, your health related or medication related issue. They are the drug custodians and they are the specialists when it comes to medication. So they are always there to help you and to use your medications safely. Thank you, Dr. Chidema, and to my listeners.
Wow, a round of applause, everybody. Please give a clap for Lukman. He has done an amazing job.
Thank you so much. My pleasure.
But one challenge that many people face is having access to these healthcare professionals. That's why we at Dr. Care 47, we are available. We have an app as Dr. Care 47, which is available on your Play Store or in your App Store, where you can download the app and then chat with any of our doctors. We have general practitioners, we have doctors in different fields which you can chat with at very discounted prices and state your complaint instead of going all the way to the hospital. It will be attended to you right there on the app, and any information you want to find out on the app, you can access us either via our website or on Instagram. And we are running a lot of programs right now, so you can find it on our Instagram page. We have our campus ambassadorial program and many other programs. You can check us on Instagram at Dr. 47. Follow us and ask us any questions that you have. If you want to join our campus ambassadorial program, you can also volunteer to join, and then we will lead you on how the process should go. So
Wow.
right now, as I'm
Amazing.
talking about all these things, we want the audience to drop any questions that you have for Buki, he has done a very good job, a very amazing job for all of us. So if there's any question that you have for him, we don't have so much time, so we might not take a lot of questions, but we take as much questions as we can. So if you have any questions, please drop it on the chat box, and then we will ask Lukman right there, right now. But before the questions, Lukman, can you just give us a very good summary on some of the things that we need to take home from today's section? And as the talking, please, you can just drop the questions, and then we'll answer it after it's done. Just maybe within 3 minutes or so, just summarize what we take home from Lukman. Thank you so much.
Thank you so much, Dr. Chidema, and thanks to Dr. Care 247 for the platform created where we can access the healthcare practitioners, the doctor, that is doctor in your pocket. It's just your phone. You can easily access and talk to doctor. So as we are gradually coming to an end of today's webinar, I like to leave you with one simple message. Medicine or medicines, quite all right, they save lives, but only when they are used safely and correctly. Remember I said all substances are poisons. The right dose differentiate a poison from a remedy. I like this principle so much because if you're able to follow this principle, that you see your paracetamol, ordinary paracetamol, the name paracetamol, very easy to pronounce, very easy, So if you see paracetamol as, oh, if I use this medication, this paracetamol correctly, that is when it becomes a remedy. But remember, when you use it wrongly, you take overdose, it is no longer a remedy. It becomes a poison. So today we have learned that medication or medicine safety is everyone's responsibility, not just Pamluki, not just Dr. Chidima, not just healthcare professional responsibility, but you and I responsibility. So we have discussed some common medication mistake. We debunked what we know some popular misconceptions, and share practical steps to help you use your medicines safely. Remember, know your medications. Please follow the prescribed dose and instructions being given to you by your healthcare provider. Please, if Mama Chineye is not here, send this message to Mama Chineye. They should stop sharing medication, or they should stop self-medicating or medication. And help me send this message to that same patient who is always Google searched before visiting healthcare facility. Please and please, what you are seeing on Google is quite different from what healthcare professional will tell you. Stop self-medication. Also, malaria and typhoid, they are not twins. You are tested for malaria, but you're not tested for typhoid. But you combine, you even be telling the healthcare provider, you only give me anti-malaria. How about that typhoid medicine? You did not give me. Who told you you have typhoid? Please, they are not twins. Before you commence those treatments, my point is always do proper testing. Please check expiring dates and store your medicines properly. Check for your expiring date and store your medicine properly. Most importantly, do not hesitate to ask your pharmacist or doctor whenever you are not ensured. Do not hesitate to ask them question. The safest patient is an informed patient. Thank you so much.
Thank you very much, Lukman. That's absolutely correct. I hope we have noted down some very, very, very wonderful nuggets in today's section. I know me, I've learned a lot, and I'm very sure you too will learn a lot of things in this webinar. Okay, I see that there are some questions in the chat box, so I would just put them out for them to answer. Um, what the I think okay, so if I'm spelling your name, I'm so sorry. So the person asked, is there a community or WhatsApp channel? Yes, yes, we have a WhatsApp channel. Just search Dr. K247 on your WhatsApp and then you join our WhatsApp channel. We drop information there, we drop health tips and nuggets that you should be aware of in that channel, okay? The next question I'm seeing here is for you from Lukman. The person is asking, are there any side effects of combining vitamin C with malaria medication?
Oh, fantastic, awesome, fantastic question. This is very common. We always say that anytime you are taking anti-malaria medication, not just vitamin C, there are some other supplements too, multivitamins. You are not meant to combine them together with any anti-malaria drugs. Rather, you complete the malaria medication first. After the completion could be 3 days. After the 3 days, then you can start taking your multivitamins or your vitamin C. You know, vitamin C, we are using it to boost your immune system, after the malaria has already suppressed your immune system. So we want to use that to boost your immune system at that particular point in time. But then you cannot combine the two together, because that is what we now say drug to drug interaction. So you have invited drug to drug interactions when you are doing so, meaning the vitamin C will work, but you have stopped the anti-malaria not to be able to produce its own effect. So before, as I said, before you start ironing, the what we know as the police, or you start hiring somebody to go and beat your healthcare provider, follow the instructions. So don't combine vitamin C with anti-malaria together. Rather, once you have completed the dose of anti-malaria after 3 days, then you start taking the vitamin C or any other multivitamins. Thank you so much for that fantastic question.
Thank you so much. He's absolutely correct. That might be one of the reasons why the anti-malaria you took for your confirmed malaria might not be working for you. Okay. As we wrap up today's section, let's remember some key messages that we said here. First of all, meditation can save life, but only does so when it's used correctly. But they can be harmful when they are used carelessly. Do not self-diagnose, don't self-prescribe, don't rely on assumptions. Always ask questions, as Famukman has said over and over again. Ask doctors or pharmacists, but don't you ask ChatGPT, ask the right people. Okay, seek
Absolutely.
professional guidance, make informed decisions. You can check all these professional advice or professional doctors on our app at Dr. Pet 7, as I said earlier. Thank you so much, everyone, for joining us, and thank you, Vicky. for sharing your expertise
My
with
pleasure.
us. And we cannot wait to have you in this section. I'm sure in another section in future. And I hope everyone.
Okay, I guess our network is bad. So thanks to everyone. Thank you so much for joining. So peace without problems, a guide to safe and effective medication use. I hope today's discussion has empowered everyone, on how to make a safer medication choices for yourself and for your loved ones. And together, let's promote what we know as a culture of safe and responsible. Okay, okay,
Sorry, I'm sorry for the network. I think my network is better.
yes.
I hope everyone is I think I'm not going to be like that. So thank you so much for joining us
Thank
today's
you. My pleasure.
webinar. It's a very good one, and we cannot wait to see you next. We do this every month. So just follow our page and then be aware of the next webinar. Thank you so much for listening, and thank you everyone
Thank
for
you so
joining
much.
today's
My
session.
pleasure.
Bye.
Bye.